Prostate cancer is one of the leading causes of death in men, and it kills about 78% of men found with it. Do you know that the reason they die is not because they have prostate cancer? The reason they die is not because prostate cancer is dangerous or it is one of the most dangerous diseases, but it is because these men are diagnosed or they are found out with this problem when it is late. What do I mean by being late? This cancer starts developing slowly. From a single cell to 2 to 3, it develops a mass. And later, it starts seeding in different areas. It starts transferring some parts, some cells seed, or they develop in some other places. Something which started from the prostate, it starts getting other branches within the chest cavity, within the intestines, everywhere. So that's what we call metastasizing. And this is the most common problem that most men are found out when the problem has already grown throughout the body. So the only solution we have in the hospital setting, it is just to rehabilitate you and wait until you die. So the reason to why people are being diagnosed late is because people do not know the early signs of prostate cancer. People are not aware that when you're developing prostate cancer, it shows you signs. It warns you. It tells you, come on man, I'm coming up. I'm going to destroy your life. But people don't notice this because they are not giving it attention. Let's go straight into the 8 early signs of prostate cancer that I have brought for you today. Today I bring you the most common, the obvious ones. You do not need a doctor to know this. You do not need a doctor to tell you that you need to see these signs so that you can. No. The moment you not see these signs, please run very fast. Go to the hospital so that you can save yourself before things turn upside down. Let's go straight. Number 1. Frequent urination. Wow. Now this is a little bit funnier. Someone is going to say, what do you mean by frequent urination? I mean that you visit urinating. You be urinating time after time. And let's see why. Because the prostate is located just after the bladder. In the middle of the prostate, there passes a urethra, which takes urine out of the urinary bladder. So you see, if this is to be your urine and you want to force it out or you want to urinate, the reason why you overgo there is because every time you're going to urinate, you don't empty the bladder. Why? The mass which has grown, meanwhile, it started as a small mass. You need to understand this properly. A cancer starts when it is a single cell and it starts growing, and it eventually encroaches on the space of the urethra. It eventually closes up some space of the urethra. So the urethra narrows. When the urethra narrows, when you're pushing this urine through this urethra, which has narrowed because of the mass that is growing, you need to use a lot of force. But even if you use a lot of force, you're not going to empty it clearly. Some urine, more of the urine is going to stay inside the urinary bladder. So after urinating, the bladder fills up very fast because you have urinated little and you have left much there. So after urinating, the urine is still inside, and that's why it fills up very fast and you need to go and urinate again, and that's why you call a frequent urination. Meanwhile, as you're going to urinate, this mass still, there is a way it brings resistance, and that's why we come up with the second point, which is difficulty in starting and stopping to urinate. That's why you are coming up with that second, because there is a lot of resistance here. When you're going to push the urine, you feel the resistance. You feel there is a lot of force that you're applying to urinate. And that is the pressure and that is the pain we are talking about on starting and stopping to urinate. So it is very, very important to know. If you notice this change, please run very fast. Still, there is a reduction in pressure. When you're urinating, because there is a lot of pressure when the urine is coming from the urinary bladder, but when it reaches here, there is resistance. So the resistance reduces the pressure. So your urine comes out dribbling. Literally, as a man, your prostate allows you, your urethra is long enough, and when the urine is coming with a lot of pressure, it dashes up. It makes a straight stream or an upward stream. Your stream is weak. Your urine is weak when it is coming out. That is also a sign we say weak urine stream. weak urine stream. That is very important to notice. So when you notice these changes, you urinate and you feel like the urine is not emptying, your urine comes out very slow, you urinate every time and you have difficulty and pain when you're urinating, hey, come on man, please go and check. It could be a dangerous sign. It could be a sign that you're developing prostate cancer. Point number 4, hematuria. When we say hematuria, we are saying you have blood in urine. So these cancerous masses, usually they overbleed, and even if they don't overbleed, there is a lot of trauma that is caused by this mass within the urethra. So you are likely to see blood coming out of your urine. That is very important. But not only that, we can still see blood in semen. Even in semen, you can see blood. So you have sex and at the end you ejaculate something with blood, or your semen, at the fluid which comes out during sexual intercourse, it has blood. It is very, very important to always look at what comes out of you, be it the semen, be it the sperms, be it the feces, be it the urine. Please look at those things, monitor them very well, because they could identify something very important in your life. So we say when you see blood in semen or you see blood in urine, please rush very fast to the hospital. Let's look at another point, which is ED, erectile dysfunction. Why do we say erectile dysfunction? Most of the men are experiencing erectile dysfunction or failure to erect or maintain erection, and they think that meanwhile, in one way or the other, it's because they are aging. It's because they are no longer supposed to be doing that. That's for young children. That's for young people. That's not right. You could be developing prostate cancer, and you know it's because it is cutting off saturation support. It is cutting off the supply of blood into the penile tissue. The mass is hindering many activities within the penile tissue, and that's why you have erectile dysfunction. Now, meanwhile, you might start taking Viagra, start taking the herbals and what, trying to prevent this or trying to stop this. It might never go away, and by the time they find out that you had prostate cancer, it is in the late stages, like we said, and you are qualifying for rehabilitation instead of treatment. Another point which is very important for number 7, we have lower back pain. When we say lower back pain, we are talking about someone feeling a lot of pain around the pelvic area. Don't necessarily consider someone having the pain at the back. I usually like it when I say lower pelvic pain. So when in your pelvic, when you feel some pain, don't rush to say that you have infections or you have trauma. Maybe I am old. No, you could be developing prostate cancer, or your prostate might be in danger. It is alarming. It is calling you to help. But there is something very dangerous that most people don't notice, and you call that unexplained weight loss. Now, most of the men will start saying, because I'm aging, that is why I'm having a reduction in my size. Now, any cancer, any tumor which is present in your body, usually we shall see you by decrease in size. So when you start seeing your size running very, very fast at a very terrible speed, please don't say it's because I'm not eating very well. Please first check it out. Be a man, go to the hospital, get your prostate checked out. The reason the 78% of men are dying, imagine about 78% of men are dying around the world, is because they are diagnosed with prostate, but not because the prostate is the problem, but because they have been diagnosed late. So make sure that your prostate is cleaned. If you found this video important to you, or if it is informative to you, please share it, like, and subscribe to our channel so that you can see us the next time. And if you are interested in knowing how naturally someone can have the prostate in a good condition by doing prostate massage, by eating the right foods that we talked about that can really facilitate this prostate, please subscribe and watch our videos, and you can comment prostate, and we shall keep giving you the best information. See you in our next video. Bye.